Hey everybody, welcome back to the decompression table, and we're going to talk about C-spine or neck today. So as you can see, April was gracious enough to help us out, get away from her billing, and we have this set up now for a C-spine disc. What we typically see is it's going to go down the arm on one side or the other. Our orthopedics and our neuro is going to help us differentiate that that is in fact what it is, a disc. But this is also going to help us differentiate as well. So depending on our angle is depending on what disc level that we think it is. C7, C6, 5, 4, 3. Depending on where that disc angle is, we're going to raise or lower the table to get a different angle. And then we're going to have different weight settings, so it's going to intermittently pull, hold, and release. And this combination is going to help us differentiate, do I have a disc or don't I? And it's also going to help me determine what level it is. Again, based on our history, our examination, and our assessment. So when we look at this, this will better allow us to then break down, is it just a disc that's driving her pain and symptoms, or is there a biomechanical component? You may have a nerve that's being irritated, giving you the radiculopathy, but you're not sure whether it's the disc that's driving it or the biomechanics or the subluxation. So this is one of our differential diagnostic tools to help us down that path. If the patient gets off the table and they feel better, then we know that we're probably dealing with a disc and we start disc protocol. And that also tells us that we may need to order an MRI. If the patient comes off the table and they feel worse, then we know it's probably biomechanical. And again, refer back to the x-rays. And once again, if we're thinking that it's a disc and it is a lateral disc, we can slightly move this over to the side and affect one side or the other of the disc involvement. So we have a lot of options, but this is a differential diagnostic tool to help us assess exactly what tissue is the pain driver for this particular patient. Thank you folks for tuning in to our educational series, and our goal is to educate you on how physical medicine and regenerative medicine, when combined together in a team approach, can best fit you to get you healing better, faster, and less amount of time. Call us today.